If you got up twice last night to use the bathroom, your risk of a serious fall just doubled. If you got up 3 times, you are now in the highest risk category for nighttime injury among seniors. But here is what almost nobody tells you. The problem is not your bladder. In most cases, your bladder is doing exactly what it is supposed to do. The real problem started 4 to 6 hours before you even got into bed, and if you keep making the same mistake tonight, you will wake up again tomorrow. I'm Dr. Kiara Walker, and what I am about to show you is not about drinking less water or avoiding caffeine. This is about 3 hidden biological systems that activate at night, and when you understand how to reset them during the day, most people stop waking up within 1 week. Let's start with what is actually happening. The medical term is nocturia. That means waking up 1 or more times during the night because you feel the need to urinate. And if you are over 60, you have probably been told this is just part of getting older. You have probably been told to cut back on fluids after 6 p.m. Maybe you have been told to do pelvic floor exercises or try going to the bathroom twice before bed. And maybe you have tried all of that and you are still waking up. That is because the advice you have been given treats the symptom, not the system. Your bladder holds the same amount of urine it did 10 years ago. The problem is not capacity, the problem is timing, signaling, and fluid distribution. Let me explain what that means. During the day, gravity pulls fluid down into your legs. If you sit for long periods, which most people do, that fluid pools in your lower legs and feet. You might notice mild swelling by the evening. Your shoes feel tighter. Your ankles look puffy. That is not just water weight. That is several ounces of excess fluid sitting in your tissues. Then you lie down to sleep. Suddenly, gravity is not pulling that fluid down anymore. It redistributes. It moves back into your bloodstream, gets filtered by your kidneys, and goes straight into your bladder. All that fluid you accumulated during the day hits your bladder in the middle of the night. That is problem 1. Problem 2 is hormonal. Your body produces a hormone called ADH, antidiuretic hormone. Its job is to tell your kidneys to make less urine at night so you can sleep. When you are younger, ADH rises at night and your kidneys slow down. But as you age, ADH production drops. Your kidneys keep working at the same pace all night long. They do not get the signal to concentrate urine and hold onto water. So even if you did not drink anything for hours, your kidneys are still filling your bladder. Problem 3, and this is the one almost nobody talks about, is nerve sensitivity. The nerves in your bladder wall are supposed to send a signal to your brain when your bladder is about 70 to 80% full. That gives you time to wake up, get to the bathroom, and empty comfortably. But with age, those nerves become hyperreactive. They start firing early. They send the full signal when your bladder is only 30 or 40% full. Your brain gets a false alarm. You wake up thinking you are about to burst, but when you get to the bathroom, barely anything comes out. You have been woken up by a signal that should not have fired yet. These 3 problems, fluid redistribution, low ADH, and hyperactive bladder nerves, work together, and they all get worse if you do not understand the timing of your day. Here is why this matters more than you think. Waking up once or twice a night is not just inconvenient, it is dangerous. Every time you get up in the dark, you risk tripping, losing your balance, or falling. Falls are the leading cause of injury-related death in adults over 65, and a significant percentage of those falls happen at night on the way to the bathroom. But even if you do not fall, the sleep disruption itself is destroying your health. When your deep sleep gets interrupted multiple times a night, your brain cannot complete its cleanup process. Waste products build up. Your memory suffers. Your risk of dementia increases. At the same time, broken sleep raises your cortisol levels, spikes your blood pressure, and makes it harder for your body to regulate blood sugar. People who wake up frequently at night have higher rates of diabetes, heart disease, and weight gain. And it is not because they are eating poorly. It is because their hormones are being thrown off every single night. Then there is the emotional cost. You start to dread going to bed because you know you will be up again in a few hours. You feel tired all day. You avoid traveling or staying overnight at someone else's home because you are embarrassed. the anxiety builds, and the anxiety itself makes the problem worse because stress hormones make your bladder even more sensitive. This is not something you just live with. This is something that gets worse the longer you ignore it. So what do you do instead? I am going to give you a 4-part protocol that resets all 3 systems. These are not tips. This is a system. Each part works with the others. You cannot skip one and expect full results. The first strategy is the most important, and it is the one that sounds completely backward until you understand the science. If this is your first time on this channel, subscribe now. We focus on practical, evidence-based health strategies for seniors that actually work in real life, not in a lab. Let's start with strategy number 1. I call this the afternoon fluid front-loading method. Here is what most people do. They drink water randomly throughout the day. A little in the morning, a cup with lunch, maybe a bottle in the evening while watching television. Then they hear they should not drink before bed, so they stop drinking after 6 p.m. But by then, the damage is already done. Here is what you need to understand. Your kidneys do not process water instantly. It takes time. When you drink a glass of water, it moves through your stomach, gets absorbed in your intestines, enters your bloodstream, and then gets filtered by your kidneys. That entire process takes about 90 minutes to 2 hours. So if you drink a glass of water at 7 p.m. and go to bed at 10 p.m., that water is hitting your bladder right around midnight. That is why you wake up. The solution is not to drink less. The solution is to drink earlier. Here is the protocol. From the moment you wake up until 4 p.m., drink 70 to 80% of your total daily fluids. If you need 64 ounces of water per day, that is about 48 to 52 ounces before 4 p.m. Then, between 4 p.m. and 8 p.m., drink only 10 to 15 ounces, small sips, just enough to stay comfortable. After 8 p.m., nothing except tiny sips if you are taking medication. This gives your kidneys a full processing window. By the time you go to bed, the fluid load from earlier in the day has already been filtered and eliminated. You are not going to bed with a backlog. Now, I know what some of you are thinking. If I drink that much water early in the day, I will be running to the bathroom all afternoon. Yes, exactly. That is the point. You want to empty your bladder while you are awake, while the lights are on, while it is safe. Better to go to the bathroom 4 times between noon and 5 p.m. than twice in the middle of the night when you are groggy and the hallway is dark. This is called strategic urination. You are controlling the timing instead of letting your body decide for you. Do this for 3 days. Just 3 days. Track your nighttime wake-ups. Most people go from 3 or 4 times a night down to 1 or 2 just from this change alone. That is how powerful timing is. Hashtag part 2 of script. Approximately 1,500 words. Now let's talk about strategy number 2. This one addresses the fluid pooling problem I mentioned earlier. It is called the afternoon leg elevation rule, but the timing is everything. Most people have heard that elevating your legs can help with swelling. Maybe you have tried it. You prop your feet up on a pillow right before bed, lie there for 10 minutes, then go to sleep. And it does not work. Here is why. When you elevate your legs, you are forcing all that pooled fluid out of your lower legs and back into circulation. Your kidneys immediately start filtering it. That is good. But if you do this right before bed, all that filtered fluid is going into your bladder while you are asleep. You have just loaded your bladder right before lying down. That is the opposite of what we want. Here is the correct way to do it. Between 4 p.m. and 6 p.m., find 20 to 30 minutes to lie down with your legs elevated above the level of your heart. You can do this on your bed, on the couch, anywhere comfortable. Use pillows under your calves and feet so your legs are angled upward, not bent at the knee. You want a gentle slope from your hips to your feet. Now stay there for 20 minutes. During this time, that fluid is draining out of your legs, moving back into your bloodstream, and your kidneys are processing it. But here is the key. After those 20 minutes, get up and go about your evening. Do not go to bed yet. You need at least 3 to 4 hours between leg elevation and bedtime. Why? Because in that window, you are going to urinate 2, 3, maybe 4 times. All that fluid your kidneys just processed is coming out while you are awake. By the time you actually get into bed at 10 or 11 p.m., your system is clear. There is no backlog. Your bladder is not holding onto fluid that accumulated all day. If you sit most of the day, this step is not optional. Sitting for hours is one of the biggest contributors to nighttime urination, and most people have no idea. Combine the afternoon fluid front-loading with the afternoon leg elevation, and you have just eliminated 2 of the 3 main causes. But we still need to deal with the third one, those hyperactive nerves. Strategy number 3 is where we retrain your bladder's signaling system. This is not about doing 100 Kegel exercises. In fact, for many people over 60, standard Kegels make the problem worse. Let me explain. Your pelvic floor is a group of muscles at the base of your pelvis that supports your bladder, bowel, and reproductive organs. These muscles also control the opening and closing of your urethra. When those muscles are weak, you can have leakage. But when those muscles are too tight, you get something called pelvic floor hypertonicity. The muscles stay clenched. They do not relax. And when your pelvic floor is chronically tight, it puts constant pressure on your bladder. That pressure makes your bladder think it is fuller than it really is. The stretch receptors in the bladder wall get compressed. They fire early. You get the urge to go even when your bladder is barely holding anything. Most people assume their pelvic floor is weak. So, they do Kegels. They squeeze and hold, but if your pelvic floor is already too tight, squeezing it more just makes the false signals worse. What you actually need is to teach your pelvic floor to release. Here is how you do that. This is best done in the evening, about an hour before bed. Lie on your back with your knees bent and your feet flat on the bed or floor. Place one hand on your lower belly, just below your navel. Close your eyes. Now breathe in slowly through your nose for a count of 4. As you breathe in, let your belly rise. But here is the important part. As your belly rises, I want you to consciously relax your pelvic floor. Imagine the entire base of your pelvis softening and dropping downward, like an elevator going down one floor. You are not pushing. You are releasing. Let everything go loose. Then breathe out slowly through your mouth for a count of 6. As you exhale, your belly falls naturally and your pelvic floor gently lifts back up. Not a squeeze, just a natural return. Do this for 8 full breath cycles. In for 4, pelvic floor drops. Out for 6, pelvic floor rises. What this does is retrain the coordination between your diaphragm and your pelvic floor. They are supposed to move together. Breathe in, both go down. Breathe out, both come up. But in many people, that connection is broken. The pelvic floor stays locked in one position. This breathing pattern restores that rhythm. And when your pelvic floor learns to relax again, the constant pressure on your bladder disappears. The false full signals stop. Your bladder can actually fill to a normal capacity before it tells your brain it is time to go. Do this every night for 2 weeks. It takes less than 3 minutes. And I will tell you, this is the step that surprises people the most. They do not expect a breathing exercise to change how many times they wake up at night. But it does, because the problem was never the bladder itself. It was the muscle around it that forgot how to let go. Now, strategy number 4. This is the final step right before you get into bed, and it is called the double void technique. Here is what it is. About 10 minutes before your target bedtime, go to the bathroom. Empty your bladder completely, or at least you think you are emptying it completely. Here is what most people do not realize. When you urinate, your bladder contracts and pushes out most of the urine. But in many people, especially as the bladder and pelvic floor age, there is always a small amount left behind. It is called residual urine. It might only be an ounce or 2, but that 1 or 2 ounces is enough to trigger a wake-up 3 hours later. So after you finish urinating the first time, do not stand up right away. Stay seated. Wait 20 to 30 seconds. Lean forward slightly. This changes the angle of your bladder and urethra. Now try again. You will almost always find there is more. It might just be a small amount, but it comes out. That small amount is the difference between sleeping through the night and waking up at 2 a.m. Now stand up, wash your hands, and go to bed. Do not drink anything after this. Your bladder is now as empty as it can be. You have given yourself the best possible chance at uninterrupted sleep. This technique is used in clinical settings for people with incomplete bladder emptying. It is simple, it is free, and it works. If you have been following along and taking notes, let me know in the comments. Tell me which of these 4 strategies you are going to try first tonight. I read every comment and I want to hear what works for you. Let me give you 2 bonus strategies that make everything else work even better. First, pay attention to your dinner. If your evening meal is high in sodium, your body will retain extra water. Your kidneys will try to flush that sodium out overnight, and that means more urine production while you sleep. Check the sodium content of whatever you are eating after 5 p.m. If it is over 600 milligrams, that is likely contributing to your nighttime wake-ups. Save the salty foods for earlier in the day. Your dinner should be moderate in sodium, rich in fiber, and balanced in protein and healthy fats. This keeps your blood sugar stable overnight, which also reduces wake-ups. Second, temperature matters more than you think. Your core body temperature needs to drop by about 2 to 3 degrees for you to stay in deep sleep. If your bedroom is too warm, your body cannot complete that drop. You sleep lighter. And when you are in light sleep, every small sensation gets amplified. That includes the sensation of mild bladder pressure. Keep your bedroom between 65 and 68 degrees Fahrenheit. Use breathable sheets. Let your body cool down. You will sleep deeper. And deeper sleep means your brain is less likely to respond to small bladder signals. One more thing. If you are taking medication for blood pressure or fluid retention, talk to your doctor about the timing. Many people take diuretics or blood pressure medications in the evening. That forces your kidneys to work overtime at night. Ask if you can move those medications to the morning. That one change can eliminate an entire nighttime bathroom trip. Do not stop or change medications on your own. Have the conversation with your doctor. But it is worth asking. Let me put this all together for you. Here is your complete daily protocol. Morning to mid-afternoon, drink 70 to 80% of your daily fluids. Between 4 p.m. and 6 p.m., elevate your legs for 20 to 30 minutes, then get up and stay active for the rest of the evening. Between 4 p.m. and 8 p.m., drink only small amounts of water. After 8 p.m., no fluids except small sips with medication. About 1 hour before bed, do your pelvic floor release breathing for 8 cycles. 10 minutes before bed, use the double void technique. Then get into bed in a cool, dark room. That is the system. It is simple, it is realistic, and for most people, it works within 3 to 7 days. You should notice fewer wake-ups by the end of the first week. Some people see results on night 1. Others take a few days for their body to adjust to the new fluid timing. Be consistent. Give it 1 full week. Now, this protocol works for functional nocturia. That means there is no infection, no prostate obstruction, no uncontrolled diabetes, no serious kidney disease. It works when the problem is behavioral, hormonal, and muscular. If you try this for 2 weeks and you are still waking up multiple times every night, or if you have pain when you urinate, blood in your urine, or sudden changes in urination patterns, see a doctor. Those are signs of something that needs medical evaluation. This is not a replacement for diagnosis or treatment. This is a supportive strategy that addresses the most common causes of nighttime urination in healthy older adults. Here is what I want you to do. Try this tonight. Tomorrow morning, come back and leave a comment with 1 number. How many times did you wake up? Just the number. Then try the protocol for 7 days and comment again with your new number. I want to see your progress, your results. Help other people realize this actually works. If someone you know is struggling with this, share this video with them. Sleep is not a luxury. It is a foundation of health. When you sleep deeply, your brain clears waste, your immune system strengthens, your hormones balance, and your body repairs itself. Waking up multiple times a night destroys all of that. And the longer it goes on, the harder it is to recover. You do not have to accept this as normal aging. You can fix this. It starts tonight. If you want more health strategies like this, practical and evidence-based information you can actually use, subscribe to this channel. We are here to help you stay healthy, strong, and independent as you age. Sleep well.